Hi, Bio4. Welcome to part 2 of respiratory. We finished talking about the nasal cavity, and now we're going to look at some other cavities, sinuses. So in this diagram, you only see one of these, but notice here how in the bone, there's a hollowed out region of the bone, and it's a sinus. It's your frontal sinus. So why would you have hollowed out pieces of bone in the skull? Well, it makes sense to actually lighten the skull because our head is pretty heavy. And so if you made it lighter by carving out some of that bone, it would be helpful. So it is helpful until you get an infection because fluid accumulates inside the sinus, right? Most of the time, we're happy that they're there. So let's talk about sinuses. Paranasal sinuses empty into the nasal cavities. So these are the sphenoid, the ethmoid, the frontal, and the maxillary. So let's look at those. And this is, again, I'm asking you, why do we need holes in our skull? And it's going to lighten the skull bones. It also helps us resonate that sound for when we want to speak our language. So let's take a look at some of these. So in this sagittal section here, we can see the frontal sinuses. So here we go. We've hollowed out some of that bone. And of the sphenoid, remember the sphenoid? So these are sphenoidal sinuses. And just think of them as those holes in the skull. So when you have a terrible headache, you're full of fluid, you have a terrible cold, frontal sinuses sometimes are a problem. That can even hurt around the eyes, right? This is harder to understand what you feel if those are full. So let's look at this other frontal section now. And in the frontal section, remember the ethmoid bone that is pretty much gives you that blade above the nose and into the skull, where you had the crista galli. So here it's showing it to you, crista galli and perpendicular plate. Well, lateral to that are the ethmoidal sinuses. So that headache around the eye when these get full, or the maxillary that just hurts the teeth. So just think of what's happening here. When you have too much fluid and it's sort of oozing everywhere, it ends up in this dead end little cavity. So it can sit there, and it can sit there, has no drainage place, and in order for it to get better, it has to essentially dry out. Dry that out, and therefore that bacteria can't, grow in there, and it can stop the infection. So these are strategic holes in bone, but they can cause problems. Okay, let's go to the nasopharynx. So pharynx, remember, is that tube that is shared. But we're going to call it 3 different things. Nasopharynx, when it is in the region closer to the nose. So let's think of this. Internal nares, I'm saying here, lead to the nasopharynx. So you're breathing in through the nose, and that air is going to hit in that region of the pharynx. What region? The nasal, because that's what's behind the nose. There is respiratory epithelium that lines the upper respiratory system is full of little cilia, and that ciliation then can trap dust particles that are coming in, and you can sneeze them out, cough things out, and remove some of those particles that enter when you breathe. So the respiratory epithelium is important. The name of it is pseudo-stratified because it kind of looks like it's 2 layers, but it's not really. So the name is pseudo-stratified. It's more like a simple epithelium, but looks stratified. And it's ciliated. So it has cilia on it. It's columnar epithelium. Remember that one? You did some drawings of that. And it is full of goblet cells. Goblet cells galore. So they're going to be secreting mucus, and some of those particles are going to get trapped in there, and then you avoid having them inside your lungs. This is a picture of that epithelium. So columnar epithelium and goblet cell, goblet cell, goblet cell, and it's creating that mucus here. And those cilia, this little ciliation here, is going to allow particles to move back up, and you can sneeze them out, or if they're lower down, you're going to cough them out. So see here the cilia too. I'm going to do my pen, and yeah, so this is all ciliation here that's going to trap junk that ends up landing on there. These are just the nuclei, and these are our wonderful goblet cells. Excellent. That is the respiratory epithelium. Remember, it's going to moisten that incoming air. And when you want to smell something, it's that mucus is going to be an environment for those airborne chemicals to dissolve in. And if they dissolve in that fluid, now those neurons, now it's a chemoreceptor that's sitting there. So that chemoreceptor is now able to understand that airborne chemical. Not when it's airborne. It has to first dissolve in that mucus of the nose. So I don't know if you've noticed, if you're in a place that's like very dry and very cold, and you can't smell very much because the dryness isn't helping, less of that mucus in the nose, and then very cold, some of those neurons are not reacting and you can't smell as well. It's interesting. So you have lots of capillaries under the epithelium of the nasal cavity. That's very capillarized, and it's going to warm that incoming air. It looks like a rug. Surface view of the epithelium here, it looks like a shag rug, right? Lots of cilia. The pharynx goes from the area of the internal nares to the larynx, and it's shared between the respiratory and digestive, I've told you that, and it's divided into 3 regions. So we will start the next video with those regions of the pharynx. Thanks for listening.